Welcome back into Listens Live. I'm Michael Vanna. We're joined now with a familiar face to the program. Dr. Robert Schroering of Advanced Implant Centers is joining me. Dr. Schroering, thanks for being back on the show today. We appreciate it.
Yeah, Michael, it's great to be here.
Absolutely. Dr. Schroering, when you're looking in the marketplace and there are people out there, they have a lot of options of where they can have dental implants done. But the thing is that's so important from at least my opinion is make sure you're looking at apples to apples. Can you talk about how all dental implants aren't maybe created equally?
I'm glad you asked that question because it is true. Not all dental implants are created equal. And there's a lot of dentists that do this and they do it part-time. It's not something they do full-time. I started doing this 36 years ago, and I knew at that point that this is really something that just takes and should engulf 100% of what I do if I want to do it well. And it shows. You know, we have about a 600% better success rate than what you see out on just the average dental implant office in the United States.
So over 600% is a huge number, obviously, and I think people watching right now, they're like, well, I want that. You know, I want somebody that has that level of success. What would you attribute that to? Because that number is unbelievable.
Well, I attribute a lot to just being able to do something for years and years, and I've been a part of a lot of research in dental implants. I've been a part of really figuring out what do we do to make this successful, and not just a short term, successful in the long run. I don't consider somebody coming in and having implants for 10 years success, or 20 years success, or 30 years and then lose their implants and that being success. I consider success somebody that comes in and they have those implants and it lasts a lifetime. And we back that up. We give them a lifetime warranty.
You know, Dr. Schroering, you talk about sometimes we've talked off camera about how patients will come in that maybe had them done elsewhere, and you've got to redo it. Nobody wants to go through that pain of having to fix the problem. It's really important that you do it right the first time. And I think the fact that you just said 20, 30 years, that's not even enough. You want it for forever. Talk about that and how important it is to have it done right the first time.
Well, nobody wants to spend the money on dental implants because it's fairly expensive. They certainly don't want to spend the money twice.
Right.
And it's not really even twice, because if you come back in and you've lost implants, you've lost the bone and you've lost the substructure that you need. So now we have to do something more drastic. So those patients come in and honestly it costs about double. I've had some patients have implants as little as 3 to 4 months somewhere else, come in and they've already had failures. And now we've had to redo all that. I want my patient to know that when they're done, they do their part, their hygiene and different things. We give them a whole battery of things to help them that. We see them every 6 months to make sure that happens, that this is going to last. Most patients come in because their teeth are bad and they've spent a lot of money on their teeth and they're really at their wits' end because they're just, you know, nothing works. Is this going to work for me? And we have, I wanted to mention this, we have a brand new implant. I had some input on it. I was one of the first in the United States to use it. That was 6 months ago when I started putting this in. I have put 500 of these implants in.
Already?
I have yet to have one failure of those 500 implants. Now that's unprecedented. Most failures occur within the first year, and it's about a 6% rate that you see in the U.S. That'd be 30 failures of those 500. I have yet to have one failure. A lot of it's because the bone, the covering that it has, it's called an HO nano surface, but it's exciting for me. I've had a great success rate before that, only a failure rate of 0.58% for any of those patients come in, non-smokers, but an average, I said, is 6%. But with this, I've had 100% success.
Yep.
That is unheard of.
And that's what I love about Advanced Implant Centers and all the conversations we have. You're always working to what's the next best thing, right? So
yes.
To give your patients that experience. And speaking of your patients, we were able to catch up with a couple of them just the other day, and here's what they had to say.
This has changed my life drastically because I wouldn't go out and smile anymore because I didn't have any teeth. I'd had dentures, but the dentures would fall out. I could never wear the bottom dentures because they would never stay in. So I could never go out and eat with anybody. I'd always stay at home. So it's been a great change. Going to Dr. Schroering was life-changing because there was no pain with it at all.
This procedure 100% changed my life. I feel more confident in my health. I love to smile, maybe sometimes too big. People go, whoa! But yes, it changed my life. I feel happier. I feel like he gave me my smile back, and that's priceless. I would 100% recommend Dr. Schroering. From the time I walked out of that office, people started popping up in my head. Who can I tell? Who can I tell?
You know, Dr. Schroering, you see the emotion on her face. You know, what does that mean to you personally? And that's something you see often, isn't it?
It really touches me every time I see a patient and we finish them and they have these comments. And that's common. That's what we hear all the time. I think I have the best job in the world. I love what I do because of the results that we get for our patients. And they're as happy as can be. And you know what? That really just pierces me. I'm so glad that we can do that for them. That's what I live for.
Yeah, your passion is I mean, it's contagious. You can tell just how much you care, and you know, seeing the smiles that we're looking at, some before and afters on the screen right now, their smile says it all. I mean, and that's not even, you know, hyperbole. I mean, it says it all.
Yes.
And I know how much you look forward to it. So again, if people are thinking about it, maybe they've been kicking the can down the road for a while, what would you tell them right now about the best way to get involved with you?
Well, we offer a no-cost consultation, and really, if somebody has an interest, come into the office, give us a call. I think our number's on the screen, and we don't charge anything. We take X-rays, we do things that normally that you would be charged about $750 for what we're doing that day for the 3D imaging and the quality of consultation that we give. But I like our patients to be able to understand everything before they make a commitment. So it's commitment free. Come in and see us.
All right, thank you, Dr. Schroering. We appreciate it. We hope everybody has a wonderful holiday weekend, and we'll see you next Tuesday on Wave Listens Live.